SSCY. It's our first presentation for 2022. So Happy New Year to everyone. And I'm really excited to be introducing Dr. Theule today to present on autism spectrum disorder, attention deficit hyperactivity disorder, and the parent-child relationship. So I know this is a topic of interest to many of the other clinicians at SSCY Center, and I'm sure many of the families as well. And thank you so much for joining us today. To begin, I would like to acknowledge that we are on Turtle Island, and this is the Treaty 1 land and the traditional territory of Dakota, Anishinaabe, Aninawak, Athinawak, Anishinaabe, Dene peoples, and the homeland of the Métis Nation. We respect the treaties that were made on these territories. We acknowledge the harms and the ongoing injustices and pain of the present. I'd like to dedicate ourselves to move forward in partnership with Indigenous communities in the spirit of reconciliation and collaboration. So today, the short description of the presentation for today talks about the relationship that exists between the parent and child, and how children navigate the world around them. So this research has been done in part at SSCY Center. So we have been familiar with this project for quite a few years. So very excited to hear the results. So I'd like to introduce Dr. Jen Theule. She's a registered clinical psychologist and associate professor of psychology at the University of Manitoba, where she specializes in work with children and family systems. She is a provincial and national leader in child and family mental health. Brenna Henrikson is here as a PhD candidate in clinical psychology. She completed her predoctoral residency in the Department of Clinical Health Psychology at the University of Manitoba last year, and her areas of expertise include working with children, family, and perinatal populations. Her research interests include preterm infant speech development, family systems, and attachment relationships. Karis Cochrane is a second-year PhD student in clinical psychology program at the University of Manitoba, and her research and clinical focus is on early child development, developmental disabilities, family systems, parenting stress, and family quality of life. And Michelle Ward is a PhD candidate in clinical psychology, and she is completing her predoctoral residency in the Department of Clinical Health Psychology at the University of Manitoba, specializing in child and adolescent service. Her research and clinical work have largely focused on child and adolescent psychopathology, attachment relationships, family systems, and women's health. So thank you all for joining us this morning, and I would like to turn the presentation over to you, Dr. Theule. Thank you so much.
Thank you, Elizabeth. Thank you. And thank you everyone at SSCY for having us here today. We're quite excited to be here and tell you about this project we've been working on for some time. So again, thank you for coming, and thank you for all getting up bright and early on this chilly morning and joining us despite many children at home and the busyness of many things. So we're really appreciative of your time. So as Elizabeth indicated, we're from the University of Manitoba, from the clinical and school psychology programs. We are all members of the Family and Developmental Psychopathology Lab, where we study sort of the intersection between family factors and psychopathology in parent and child. Our chat by necessity today will be quite brief, but Elizabeth is recording our talk today, as she indicated, and we'll also post the slides on our website at fdpl.ca later on. Again, that's fdpl.ca, and that is right there in our little logo too. We'd love to know more about you. There are a lot of you, and we know we won't have time for oodles of questions, although we are going to leave time for questions at the end. So if you'd like, we'd really love to hear from you and who you are and how anything in particular that brought you here, your role, if you're a clinician or a parent or both or a researcher. So we'd love to see that. So please use the chat, if you don't mind, to pop in there and indicate some of that. Just gives us a sense of our crowd, which is always tricky to know on Zoom. All right, so here's our plan for today. So you're going to hear from me a bit, and then we're going to go over to Michelle Ward, who's going to talk about shared characteristics between parent and child. And then we're going to go over to Karis Cochrane, who will be talking about parenting styles and their relationship to parenting stress and family quality of life. And then we'll move on to Brenna Henrikson, who will be talking about how parents of children with ASD understand the reasons for their children's behavior. Just given the format of Zoom, we often find it a bit simpler to leave questions till the end, and then we really left a chunk of time there to address those. So feel free to put them in the chat as we go along. We'll be doing our best to monitor that between talking points. Otherwise, at the end, you can put up your hand if you know how to use that Zoom feature, and we'll try and go around. But we'd love to hear what you have to say, because we always think that's the best part of these kinds of things. So with that, I'm going to start us with our little overview. I'm sure many of you know this, but just to make sure that we're all on the same page, autism spectrum disorder is a neurodevelopmental disorder characterized by difficulties with social interaction and communication, as well as repetitive behavior patterns, interests, and activities. It is a increasingly prevalent disorder. Recent numbers have about 1 in 66 Canadian children and youth have an ASD diagnosis. And more boys than girls. This more boys than girls thing is going to come up a little bit, as I'm sure all of you know. The exact numbers of how many more boys and girls is point under discussion. All right, the next disorder we're going to talk about is ADHD, or attention deficit hyperactivity disorder. It is also a neurodevelopmental disorder. It, however, is characterized by inattention, hyperactivity, impulsivity, or all of those things. It has a prevalence a chunk higher than that of ASD. Its prevalence is about 5%, give or take a bit, depending on who you ask. Again, more boys than girls, and it is highly comorbid with ASDs. So, as you'll see here, the majority of kids with ASD will also meet criteria for a diagnosis of ADHD. So it's a big, big chunk of them. And about 15 to 25% of individuals with ADHD have ASD. I make no claims that that Venn diagram is accurate. That was just me drawing in PowerPoint. Approximate those numbers. Okay. So other things we have to talk about when we're talking about ADHD and ASD, especially as we're getting into parenting, is talking about genetics. So first of all, we want to talk about, we were just talking about the comorbidity or co-occurrence of autism spectrum disorders and attention deficit hyperactivity disorder. Some recent evidence out of Denmark point to some shared genetic variants between those two disorders. So that means we think that there's some new evidence showing that the same genes in some cases are leading to both ASD and ADHD. So not only are these disorders both genetic, but they are maybe caused by the same genes. Maybe, probably in some cases, given that for those of you who know a lot about this literature, the research is showing that ASD, both autism spectrum disorders and ADHD, are probably a variety of different disorders we've sort of lumped together under one label. They're probably actually more than one disorder. So that said, both disorders are highly genetic. We've known that for decades. That is not new information. So twin studies were some of the first to show the shared genetics of both of these disorders. So we know that identical or monozygotic twins are more likely to match on diagnostic status, be that ASD or ADHD or both, than dizygotic, so fraternal twins. We also know that ADHD has some of the highest genetic loading of any mental disorder. So the genetic loading of ADHD is higher than that of absolutely everything. Bipolar disorder comes pretty close. ASD is lots of biological processes and physiological processes involved in ASD, a little bit less genetic loading because there's a whole bunch of other factors like premature birth and environmental insults that are just a stronger push in ASD. Still, we don't think it's a parenting thing. ASD, though, very highly genetic, though, despite that, in addition to those genetic things. So there were some older ideas, quite some time ago, but the shadows of these ideas continue to impact our work today, that poor parenting caused autism spectrum disorders and or ADHD. That's still a pretty common idea. Is with respect to ADHD in the popular literature and the media, that's still sometimes an idea that these are just kids whose parents can't control them or can't handle them, and the evidence doesn't show that that's the case, and those ideas really get in the way. That said, we think these disorders are genetic, and they're largely genetic, but there's some evidence that parenting is still a factor. It's a factor in what we see, and it's a factor in presentation. It's a factor in how well parents and kids do. Also, given shared genetics between parents and children, parents of children with ASD and ADHD often show those disorders or subclinical versions of those disorders themselves, which makes perfect sense. If I have a highly genetic disorder and my kid has it, there's a pretty good chance I have it, or maybe like a low level of it. But it's still a factor. And that might have been some of what some earlier researchers and theorists were seeing, was because there are some of those shared characteristics. One of those subclinical versions of these disorders with respect to ASD is often called the BAP, or the broader autism phenotype, which means like basically like a subclinical. So it's not diagnostic. It's not, these parents don't have ASD, but they sort of show signs. They're maybe on the spectrum, but not quite over the line where we call it a diagnosis. We also, again, to reiterate, we don't think that parenting causes ASD or ADHD, but we do think that there's a bidirectional or back and forth relationship between parenting and child diagnosis. So parenting is affected by ASD and ADHD, and parenting affects ASD and ADHD. It can't make you have it or not, but it can affect the presentation. It can affect especially some co-occurring behaviors like externalizing behaviors. We know lots of interventions involve parenting, so certainly parenting is a factor. For example, we know that parents of children with ASD and ADHD have incredibly elevated levels of parenting stress. And conversely, we know that one of the primary treatments for ADHD is parent management training. So we know that there's sort of like these two factors impacting one another. That said, parent management training, which is one of the primary treatments for ADHD, doesn't end ADHD. It mostly actually addresses the externalizing behaviors, but it is a primary treatment. It impacts functioning to a great deal. So we think that there's sort of this back and forth relationship between these two factors, and that's going to be our focus for today. Pardon me. So this is a group project we're going to be talking about. We had these two students who we have here with me today, Brenna, Karis, and Michelle, plus a couple of honor students who helped out with the project. So we recruited English-speaking mothers who had a son between 6 and 11 years old who lived in Canada or the US. All the children we'll be talking about with neurodevelopmental disorders were previously diagnosed with these disorders, and then we confirmed the presence of clinically significant symptomology with some questionnaires. We recruited these participants from February 2020 through March 2021, so a whole lot of COVID time, very much by accident. The study was completed online. It was a survey, a decent length survey. We had more than 500 families in the end, many of whom came from SCY, and we really appreciate everyone's help there at SCY and posting and letting your clientele see about our project. We really want to know about the experiences of these families. We also recruited from a number of other settings, so St. Amant, Asperger, Manitoba, similar agencies in other provinces and states, lots of online groups, parenting groups for parents of kids with and without ASD or ADHD, et cetera, online advocacy groups, all those kinds of things. Also some community postings for typical parents, which you'll hear a little bit about as well. So with that, I'm going to pass over to Michelle Ward, who's going to talk about her project on shared characteristics between mother and child.
Thanks, Jen. Okay, so yeah, as Jen suggested, I'm just going to be talking about the shared characteristics between mothers and sons with ASD and ADHD. And so when we go to the next slide, while times are changing, we know that mothers continue to carry greater household responsibilities than fathers overall in general, and research still continues to support this to this day, even research during COVID times. And this is particularly true for mothers of children with ASD who report having greater responsibility over childcare and household tasks, as well as greater unmet support needs compared to fathers of children with ASD. And so with that, it's also not surprising that mothers report higher levels of parenting stress compared to fathers, and also compared to mothers of typically developing children. In fact, this is one of the most researched factors in the ASD literature, and findings suggest that moms of children with ASD experience higher parenting stress levels than mothers of children with other disabilities like Down syndrome, cerebral palsy, and intellectual disability. So this is a really prevalent issue and challenge for families of children with ASD. But what about the moms themselves? We often don't consider how their own traits or their characteristics might play into this factor. Despite growing interest in parenting experiences of mothers with children with ASD, research rarely considers the very likely prevalence of autism characteristics in that dynamic for the mom. And so the issue with this is that ASD diagnostic rates are higher in parents of children with ASD than in parents of children without. And even in the absence of clinical impairment, parents of children with ASD are more likely to demonstrate those subthreshold ASD characteristics that Jen was talking about, called the broader autism phenotype. And so just to get a little bit more into the broader autism phenotype, it represents a subclinical pattern of personality traits and behaviors that are similar to those seen in ASD. So just as ASD involves social communication difficulties and rigid behavior patterns, the BAP involves increased rigidity, difficulties with pragmatic language use, and more aloof social patterns. But it's really important to note that this is not a disorder. It's and it doesn't involve clinically significant impairment. These moms with higher BAP characteristics or who would meet criteria for having the BAP, they don't have clinically significant impairment, and it's distributed. These kinds of traits are distributed throughout our population in general. Some people are just more aloof, some people are more rigid, but we do find that in families of children with ASD, these characteristics are more prevalent and at higher rates. And so while the BAP is distributed throughout the general population, it's just more common in parents of children with ASD, which suggests that research on parenting dynamics in ASD populations really should be considering the contributions of maternal BAP characteristics and paternal BAP characteristics. But really for my research, I'm looking at moms, and this gave me some purpose and some direction for my research. And then really when I'm looking at parent-child dynamics and parent traits, I drew a lot of inspiration from the ADHD literature, because there's been a lot more research in this area about how mom's ADHD characteristics or dad's ADHD characteristics come into play. So similar to mothers of children with ASD, moms of children with ADHD report significantly higher parenting stress levels, with some research suggesting similar levels in families of children with ASD and ADHD, and some suggesting for families of children with ADHD even higher levels. And there's also some research suggesting poor parenting outcomes for these families, but parent-child fit matters. So what I mean by this is that we can't just look at the child's ADHD characteristics and leave it at that. We have to consider the parent's traits. And research has found that mismatch between mother and child, where, for example, the child has ADHD and the mother does not have ADHD, has been linked with worsened parenting outcomes compared to when both mom and child have ADHD, which seems surprising at first, because we might assume that if mom has ADHD and child has ADHD, that we're going to have even more difficulties. But it's thought that similarity in traits is promoting a shared cognitive tempo and stress relief for these families. And so this is a really interesting finding that inspired me to question whether this relationship also exists for parents of children in the ASD community. And so for my research, more broadly, I was looking at how shared characteristics between mom and son impact parenting outcomes in families of children with ASD and ADHD. But I can narrow that down to two different research questions. One is, do maternal BAP characteristics predict parenting outcomes for mothers of children with ASD? And the second is, do maternal ADHD characteristics predict parenting outcomes for mothers of children with ADHD? So when we look at the findings, for maternal BAP characteristics in child ASD, fit did not matter. There was no interaction between mother and child in terms of their characteristics when we look at the parenting outcomes. In fact, mothers of sons with and without ASD did not differ in their use of warm and involved parenting or their supervision or discipline strategies. Interestingly though, maternal BAP characteristics did matter on their own. So mothers with greater BAP characteristics like greater rigidity, aloofness, pragmatic language difficulties, Also reported less positive and involved parenting, more negative supervision and discipline practices, and significantly higher parenting stress levels. And so what we're finding here is it's suggesting that there's added parenting barriers for mothers with greater BAP characteristics. But this is a very novel area of research. There hasn't been a lot done here, and we really need to keep researching this area to fully understand why that is. And when we're talking about parenting stress, when we go to the next slide, interestingly, parenting stress levels weren't just linked to mom's characteristics. Greater child ASD symptomology also corresponded with higher parenting stress levels. So when we look at this graph here, we can really see that purple line is for mothers of sons with ASD, compared to mothers of sons without. It's significantly higher parenting stress levels. But then we also see, as we go along the x-axis, that as mom's back characteristics increased, parenting stress increased for both groups. So this is really interesting because it suggests the possibility of an additive effect where the greatest parenting stress levels were experienced by moms of sons with ASD. And so you can see that over on the very right in the purple, whereas the very lowest levels of parenting stress were experienced by mothers of sons without ASD who also had low BAP characteristics. So this is another kind of interesting finding of our research that would benefit from further exploration, just to see if we can confirm that this is additive in general. And then when we look at ADHD, we find that fit does matter, and that flows from previous research, because we're finding that dissimilarity between mother and son predicted worsened parenting outcomes, while similarity predicted less negative parenting practices and lower parenting stress levels. And so when we go to the next slide, you can see this in these graphs, which is I find these really interesting. So the green line is for sons with ADHD, And so when we look at the first graph, this is positive and involved parenting. And we can see that for moms of sons with ADHD, as mom's own ADHD symptomology was increasing, as was positive involved parenting. However, we don't see that for moms of sons without ADHD. In fact, positive and involved parenting decreased a slight amount, although not significantly. And then we see with parenting practices, the exact opposite, negative parenting practices, the opposite, which makes sense, as positive involved parenting is increasing and negative parenting practices are decreasing for moms with ADHD themselves. So you can see that green line on the right for moms of sons with ADHD, as their ADHD characteristics increase, negative parenting practices decreased. It's very interesting. And then you see for moms of sons without ADHD, so they don't have a child with ADHD, as their own ADHD characteristics increase and negative parenting practices increase. So there's something here about fit and fit similarity in between traits of mom and son, which was making a difference in these families. And then when we look at parenting stress levels, we find a similar kind of flow where the lowest parenting stress levels are here for moms of sons without ADHD who also have low maternal ADHD symptomology themselves. But for moms who have low ADHD symptomology themselves, but have a son with ADHD, they have significantly higher parenting stress levels. And so that mismatch there is problematic, it's challenging. But as mom's ADHD characteristics increase, they kind of meet where moms of sons without ADHD and with ADHD are experiencing similar stress levels. So what do we take from this? I mean, for families of children with ASD, fit does not seem to matter as much. Mothers of children with and without ASD don't differ in their warmth and involvement, which I think speaks further to our stray away from really problematic past parent blaming of assuming that parents are at fault for their children's diagnoses or challenges, because we're seeing that moms of children with and without ASD aren't really differing in their delivery of warmth and their positive caregiving approaches. But parenting stress is influenced by both mother and son traits, and maternal bad characteristics were linked with parenting outcomes. So these are things that we need to consider. And then for families of children with ADHD, parent-child fit does matter, at least for the outcomes that we were looking at. And so when there is a mismatch, we're seeing significantly greater parenting stress and even poor parenting practices. Whereas when mother and child share ADHD symptomology, there's less negative parenting and practices and lower parenting stress. So in order to best support these families of children with ASD and ADHD, we need to think about both child and parent characteristics to target and tailor our supports, because often we just focus on what's going on for the child. And even though these families are much more likely to have comorbid symptomology themselves, we also need to be thinking about how that plays in and how we can best support these families. So with that, I'm going to pass this over to Karis to tell us a little bit about her research.
Awesome. Thanks, Michelle. So I'm going to be walking through some of the findings from my study, which examined parenting styles, parenting stress, and family quality of life. And this was looked at in, again, so mothers of children with autism spectrum disorders. Okay, so even though most of us likely know what parenting stress is, briefly, it can be defined as the aversive psychological reaction to the demands of being a parent. And this is thought to occur when those demands of being a parent that one perceives outweigh those perceived resources that they feel that they have. And family quality of life can be thought of as an individual's given level of satisfaction with their overall well-being, functioning, and the relationships within the family. And when we talk about family quality of life, this is individually reported. So it's an individual's perspective on how satisfied they are with their family's functioning. So families of children, as Michelle mentioned, with ASD and ADHD have been shown to experience the highest levels of parenting stress and are also at risk for the lowest family quality of life relative to parents of children with either no disability or a whole host of other alternative disabilities. And recently, through no fault of their own, the approach to parenting that a parent adopts, or in other words, that parenting style that one uses, has been proposed to be linked to both parenting stress and family quality of life. So in other words, the way in which one parents their child is one area that clinicians can target, as this may help to serve as a buffer to improve both parenting stress and family quality of life in this population. So parenting styles can be thought of as in the way in which a parent approaches interactions with their child. And so the most common way of viewing parenting styles is in what we would Baumrine's terms. He kind of identified these styles here. And so it's thought of in terms of both responsiveness and warmth, as well as demandingness and control. So in the top left-hand corner there, the permissive parenting style is high in responsiveness and warmth, but low in demandingness and control, and even things like setting limits and boundaries. And then the authoritarian parenting style in the bottom right-hand corner is the opposite of this. So this is low in responsiveness and warmth, but high in that demandingness, control, and setting limits. And then the top right-hand corner, the authoritative parenting style, is that nice middle ground between these two. So equal parts responsiveness and setting limits, and demandingness as well. So if we go to the next slide, it's been proposed that each of these parenting styles is associated with various child outcomes. So the authoritative parenting style has been associated with those best child outcomes. So having high child autonomy, high self-regulation in children, high self-assertiveness, and even better academic outcomes. While the authoritarian parenting style has been related to poorer child outcomes comparatively. And this has been related to more child reactivity, negative emotions, more social conflicts, greater drug and alcohol use, and worse self-control as well. And then the permissive parenting style has been shown to be related to the poorest child outcomes. So even higher child reactivity, more negative emotions, social conflicts, drug, alcohol use, and poorer self-control yet again. So this brings us to that learning objective number 2 for today, which is what I looked at for my study. So this looked at which parenting styles are related to greater or lesser levels of parenting stress and higher or lower family quality of life in families of children with autism spectrum disorder. And within this, I also looked at which parenting styles are most or least frequently used in this population as well. So here we found that parents who utilize the authoritative parenting style most frequently, which again means being, responsive and warm and present while also setting limits with children, these parents reported the least parenting stress and also the highest satisfaction with how their family is functioning. And on the other hand of the spectrum, parents who reported using the permissive parenting style most frequently, so again, providing lots of warmth and responsiveness and affection, but not really setting those limits or boundaries with their children, reported the most distress, highest parenting stress, and were not as satisfied with their family's overall functioning. And then the authoritarian parenting style fell somewhere in the middle here. And finally, the majority of parents of children with ASD did report using the authoritative parenting style most often, and the permissive parenting style least often. So it is worth noting here that this was also, the study was conducted in a high income sample, which ended up with a relatively low representation of permissive and authoritarian parenting behaviors. And this also likely occurred as a result of a sort of social desirability bias, or parents, not wanting to disclose these more negative parenting behaviors. But nonetheless, it does appear that the authoritative parenting style is the most commonly used by mothers of sons with ASD. So this is really a good news story here. And this is a positive quality about these families in this population, as they seem to already be utilizing the parenting style that is associated with those positive child outcomes, even despite the added challenges that they may be facing in this population. So what does this mean practically? So research shows that child externalizing behavior, so things such as tantruming, is often the piece that parents struggle with most and therefore require the most support with. So as we can all imagine, it's incredibly hard to hold ourselves together as parents when we have a child melting down daily, sometimes even multiple times a day. And it's taxing on parents of typically developing children, but those autism-related sensory and behavioral and social difficulties can add to this struggle of parenting, meaning that parents in this population may often require more support to actually be parenting in this authoritative manner. So when we think about this in terms of a practical example, this is really relevant when we're working with parents to support them in how they are responding to their child with autism, in examples like when they are having a temper tantrum. So an authoritative manner of responding would likely mean to provide a child with love and affection in this moment, while also helping them to feel supported and to know that you're present, and working with them to let that moment pass. But this doesn't mean that you're not setting limits. So also working with, a parent to support them and letting a child know what is and isn't okay when a child is feeling overwhelmed. So for example, it is okay to cry. It's okay to go to another room, if you need space, but it's not okay to punch the wall, or it's not okay, to hit a sibling either. And so the key here as well is providing appropriate consequences, for when those not okay behaviors are happening, and also encouraging parents to lay out these consequences ahead of time, and that they're explained, with a fair warning as to what will happen, if the rules are not followed, and when a punishment is being delivered, that it's being given with, again, that explanation as to why it's happening. So another piece that we found here, and this was kind of a semi-incidental finding, but again, it fits with a lot of previous research. So we found that lower parenting stress was related to higher family quality of life. So there's this inverse relationship here. And so this suggests that if clinicians, such as many of yourselves, were to target parenting stress in treatment, reducing this would also likely increase family quality of life as well. So again, that is working with a member of even just one member of that family, a parent, has that far-reaching impact on the rest of the family unit as well. And like I said, this fits with a lot of other previous research that has found this exact same relationship. So as clinicians, when working with children, we all know that it's really common to work directly with parents to help them know how to best support their child, especially with young children and also with parents of children with autism. And so this research supports the need for that further step to do individual work with parents to actually target their own mental health, specifically to reduce their stress associated with parenting, as this may also improve the overall quality of life for that family unit. And we also have research to suggest that targeting parenting stress has the potential to improve parent-child relationships, overall child functioning, and even child development. So in terms of the key points, I guess, to take away from all of this is really, again, a good news story. So parents of children with ASD are already using, that positive, balanced parenting style, which is authoritative parenting. And I guess the other takeaway is that supporting parents to use this parenting style, which is, again, being responsive and loving and warm with their child, while also providing those structure and limits, is related to lower parenting stress in parents and higher family quality of life for the entire family. And then finally, intervening with parenting stress can also subsequently improve family quality of life. So again, intervening with just one member of that family can actually improve the entire functioning within that family system as well. So with that, I'm going to pass it over to Brenna to tell us about her study.
Thanks, Karis. Okay, so building and leading off of what's been discussed already, my project specifically was looking at autism spectrum disorders and something called parental reflective functioning. So first and foremost, I will go ahead and define parental reflective functioning because it can seem like a bit of an abstract concept, but essentially when we're looking at reflective functioning in the general population, this is something that we all engage in some capacity at some level, but this is really our ability as humans to reflect on our own and others' internal experiences. So for example, what we would define as our mental states, so like our feelings, our thoughts, our desires, our wishes, as what is actually driving those external behaviors. Now, when we look at this in the context of parental reflective functioning, this is essentially the caregiver's capacity to, again, reflect on their own experiences and their own internal mental state, so thoughts, feelings, behaviors, desires, wishes, as what's driving their own as well as their child's behaviors. So if we look at a couple examples of parental reflective functioning on the next slide, we would see that an example of someone engaging in really, true parental reflective functioning might say something like, okay, my child's crying. I think they might be crying because they're feeling anxious about going to school for the first day, maybe after the pandemic or after lockdown, or maybe it's first day of kindergarten. I think that's why they're crying. I know that internal mental state, that feeling that they're having is anxiety. So that external behavior that we're seeing is crying or maybe being fussy, being difficult. And parents who are engaging in this true parental reflective functioning are also able to reflect on their own internal states or their own mental states and go, okay, I'm also feeling really anxious about this. So that's probably why I'm becoming, more frustrated, more snippy. Maybe I'm tearing up a little bit when we're having this debate, right? That would be that true parental reflective functioning. So able to look at what's going on inside at those mental states, remember thoughts, feelings, desires, as what's driving these external behaviors. Now, examples of when parents are maybe missing the mark or not really able to engage in that parental reflective functioning, and this happens to all parents sometimes, right, at varying levels, but that might look like, I know my child is crying because they're just trying to manipulate me right now. Or what's more common and a bit less negative would be, my child is really upset right now and I have no idea why. So that would be an example of non-reflective functioning within the parent-child relationship. So moving on, we know, and after defining parental reflective functioning, it comes at no surprise that this is something that's really important for that parent-child relationship. So this is going to actually foster a child's own reflective functioning abilities. So when a parent is able to kind of meet the child where they're at, help to name some of those emotions for them, help them to understand, okay, when I'm feeling really anxious, I get upset and I cry, right? That's going to help that child to internalize that and be able to do that for themselves as they develop more fully. This is also unsurprisingly going to strengthen the attachment relationship between caregiver and child. So what I mean by that is, when a parent is able to anticipate or some of the time or most of the time anticipate what's going on internally for their child, that's going to help them to meet those attachment cues. So when a child is crying, for example, going, okay, I know my child needs to be comforted right now, I'm going to pick them up and give them a snuggle. Parental reflective functioning is going to help drive some of this. And it's also allowing for the development of emotion regulation within the child. So if a child feels understood, seen, safe, when they are experiencing some of these big emotions, and that's being met appropriately by the parent or the caregiver, this is going to help them to develop some of that emotion regulation skill as well. So it's a really important ability for a parent to hold. So moving along. Now, parental reflective functioning or reflective functioning in general is very much so, exhibited within like social constructs, right? When we're interacting with people, when we're noticing their behaviors and what's potentially driving those behaviors internally, it makes sense that individuals with autism spectrum disorders tend to have lower abilities of reflective functioning. We also know that lower levels of parental reflective functioning is going to impact the parent-child relationship. But what's important here is that although we know individuals with ASD tend to have lower reflective functioning abilities, this hasn't been studied in parents of children with ASD from that parental reflective functioning capacity. So this is what my research looked at broadly. Now, we also want to consider parental reflective functioning and the broad autism phenotype. And this is something that Michelle discussed in her research earlier, so I won't go over the broad autism phenotype too much here. But again, although reflective functioning abilities in individuals with autism spectrum disorders has been examined, and we know that individuals with ASD tend to have lower levels of reflective functioning abilities, research is again very, very limited on parental reflective functioning abilities in parents of children with ASD. And this is especially important because PRF abilities in parents who also present with higher levels of that broad autism phenotype has yet to be examined. So we know that the broad autism phenotype are these subclinical, subthreshold levels of autism spectrum disorder. So this is important to look at given that link between lower levels of reflective functioning in ASD communities and this not yet really being examined within this community of parents of children with autism spectrum disorders. So this brings me to my study objective that was outlined earlier today, which is how do parents of children with autism spectrum disorders understand the underlying reasons for their child's behavior? So how and at what level do they engage in that parental reflective functioning with their children? And what factors are really contributing to this, either higher or lower levels of this parental reflective functioning ability within this parent population? So that brings me to my research question. So first and foremost, I wanted to know, do differences actually exist in parental reflective functioning levels in mothers of boys with ASD in comparison to mothers of boys without ASD? And I hypothesized that mothers of boys with ASD would actually have that lower level of parental reflective functioning in comparison to mothers of boys without. And the reason that I hypothesized that was based on my second research question, which was, does level of the broad autism phenotype in mothers of children with ASD account for their lower level of parental reflective functioning? And I hypothesized that yes, given the symptoms that we see within the broad autism phenotype and what that really impacts, I said yes, as the broad autism phenotype level increased in mothers of children with ASD, their level of parental reflective functioning capacity would in turn decrease. So that's why I hypothesized that within this population, mothers of children with ASD would have lower levels of parental reflective functioning ability, but that would be driven by their level of the broad autism phenotype. So when I looked at parental reflective functioning ability, I looked at a few different things. So first and foremost, I looked at that kind of true reflective functioning capacity. So, if your child is crying, what do you think that means for them, right? Or how would that impact you? So that's that reflective functioning capacity. I also looked at flexibility within a parent's approach. So we know that being flexible with, understanding your child, understanding why your child is acting a certain way is really important for reflective functioning capacity. Because if we get really stuck on one thing or really fused to one idea about why our child acts the way that they do, that can actually lower that ability to engage in reflective functioning. So it's really positive to be flexible in our approach and go, yeah, I think this is maybe why they're upset, or I think this is maybe why they're feeling really excited. But, within my mind, I'm able to be flexible and kind of shift that. Now, what we also know is important in parental reflective functioning is this interest and curiosity piece. So being like truly interested and curious about, why is my child acting this way? Or, when this occurs, why do they, act in this regard or behave in this way? This is important, again, for parental reflective functioning, because it's going to increase that kind of level that you're engaging in that, if you are truly interested and curious about your child and why they behave the way they do and how they feel, etc. So those are kind of the core pieces that I looked at when I was looking at parental reflective functioning. And what I found for my research question 1 was that, yes, overall, mothers of children with ASD had lower levels of reflective functioning. So that first true piece that I looked at, that true reflective functioning piece, in comparison to mothers of children without autism spectrum disorders. So within my 2 populations, mothers of children without ASD and mothers of children with ASD, I found lower levels of that domain, of that true reflective functioning domain within the ASD, the mothers of children with ASD population. What I found next was very interesting and exciting, because I found the opposite for that flexibility piece. So that second piece that I was looking at, mothers of children with autism spectrum disorders were actually able to engage in more flexibility in regards to their child's understanding and kind of reflecting on their child's mental states, and that being, what's driving their behavior. They did that more than mothers of children who didn't have autism spectrum disorders. And what's additionally interesting is, third, when I looked at that curiosity and that, kind of like wondering and being curious of, why is my child acting this way and what are they feeling internally that's driving these behaviors? Again, mothers of children with autism spectrum disorders had significantly more curiosity regarding their child's mental states as being what's driving their behaviors, again, in comparison to mothers of children without ASD. So even though mothers of children with ASD overall had these lower levels of reflective functioning, they were better able to be flexible with their child and their child's mental states, and they were also more curious, which is really cool and really positive. So moving on to that second research question. Now, this was also what I hypothesized, which shows in the results, which again, when we look at just specifically that first point, that parental reflective functioning, as the broad autism phenotype level in a mother increased, we saw a decrease in her overall ability to engage in parental reflective functioning. So as the broad autism phenotype level increased, we saw a decrease in that parental reflective functioning, which makes sense, and which is probably what is driving this lower level overall that we observed within the ASD population, the mothers of children with ASD population that I was looking at. So overall, this means a few different things if we pull this all together. So yes, mothers of children with autism spectrum disorders might have difficulties reflecting on those underlying meanings of their child's behaviors, and they might have some lower levels of that, have some more difficulties with that. And we know that broad autism phenotype is most likely playing a role when we look at these lower levels. But mothers with children with autism spectrum disorders, again, were much more flexible and much more curious about their child in general, in comparison to mothers of children without autism spectrum disorders. So what that means is that these strengths should really be utilized in order to help build a stronger reflective functioning capacity, because what we also know about parental reflective functioning is that it can be built upon. And this isn't something that you either have or you don't have. We have parenting groups, for example, Circle of Security, another group called Minding the Baby. And when we examine parental reflective functioning before and after parents engage in these groups, we do see increased levels of their ability to engage in this parental reflective functioning, but this hasn't been examined in autism population, so in parents of children with autism spectrum disorders. But these results of parents being more curious, being more willing to be flexible, point to the fact that they would probably do quite well in some of these groups. So that is kind of my take-home points for this study. But thank you very much for listening. I'm going to pass it over to Dr. Theule now for some takeaway messages.
All right, thank you, Brenna, and thank you everyone for sticking with us in this early morning. So we appreciate that. So I'm just gonna sort of wrap up everything that we talked about, and sort of what we think are the big picture needs here. So we really want to emphasize that our research is showing that parent and child characteristics both matter when providing interventions and supports. And I bet a lot of you know that, but I bet most of our tools and our interventions really focus on child need, but there's this person we're expecting to do these things with them, these parents. And we really think that we're not paying enough attention to the needs of parents. So we think we specifically perhaps need to assess parent needs in addition to child needs. We need to find out where the parent's at in terms of ADHD symptoms, ASD symptoms, frankly, also probably other things, depression, anxiety, other factors that impact parents and their ability to do all these interventions that we need for them for the needs of their kiddos. We also need to provide additional supports to those parents who have higher needs. So without taking away supports from all families, certainly there are some families, those ones who maybe have the BAP or ASD themselves, who have much higher needs, and we need to figure out a way to focus interventions on these families, especially as time goes on. We're seeing a lot more parents who might even actually have full diagnoses of ASD themselves parenting than we did in previous generations. And those families are going to have some exceptional needs that we need to accommodate. We also want to talk about parenting stress. So sometimes we see parenting stress as a effect rather than a cause, an effect of having a child with high needs. And that's true, but it's also true that these things feed back and forth, like that transactional model we talked about at the beginning. And some of the behaviors we're talking about with kids with ASD and ADHD are not really remediable, are not going to be changed. So what we need to do is directly address the parents, provide them with coping strategies and coping skills and resources to reduce parenting stress directly rather than simply through the child's behavior, because that may or may not be possible. We do have good evidence on interventions for targeting parenting stress. And we know that those will help the whole family as well as the identified child. We do want to point out, we think this is really quite fascinating, this new research on parental reflective functioning and directly addressing that in parents with the BAP. And again, as Brenna mentioned, she mentioned 2 evidence-based interventions that have very good evidence for parental reflective functioning, Minding the Baby and Circle of Security. I'm sure there are others. I'm sure, frankly, if I thought about it, I could think of others that I would think based on what I know about research would, but I don't know that I have the evidence for that. But certainly there are interventions for improving these capacities themselves. Actually, I forgot to mention with regards to parenting stress, we do have some good research for CBT-based models for parents, ACT or acceptance and commitment therapy models. So there are some nice models for directly reducing parenting stress. In terms of future steps, we have already started in our next project on families of children with and without neurodevelopmental disorders. In this upcoming project, we're looking at family quality of life, parenting stress, co-parenting quality, which is sort of a sideline, looking at more of the system. We want to look at this part of the family system down here too, as well as parental depression, which is a factor we didn't look at in this project, and social support, as well as all the other things we were talking about. So hopefully we would love to collaborate with SSCY on this project too. This project is going through ethics right now. We hope to have that started ASAP. We, of course, hope to get started sooner, but none of these things ever go quite according to plan. So that's what's coming up in the future for all of us. So I want to thank you all.